Hi, Dr. Blake here again with Chiron Healing Arts. I want to talk today about the 5 I's of what not to do with your pain. Some of these are things that you've probably been told to do, sometimes by other doctors, and they're quite detrimental to your prospect of healing from an injury or from chronic pain. So, the first thing, ibuprofen. I love ibuprofen. It's my favorite pharmaceutical drug, and I have great respect for it. What ibuprofen does is it acts very powerfully on one area of the inflammatory pathway called the COX-2 pathway. And this is important to understand because inflammation is the body's way of healing. It literally is the milieu that the body uses to heal, like from an injury, for example. So, using injury as an example, if you're out mountain biking and you tweak your knee, you're out hiking, you roll your ankle, whatever, you don't want to be using ibuprofen if at all possible, because there's an initial healing reaction that's happening in your body, and you're just stopping it with ibuprofen. You're just saying, and it feels good because it calms down the pain, because inflammation brings pain with it. But this will lead to potential downstream effects, and you may have chronic pain from the region because it didn't really heal properly. All the connective tissues didn't heal properly because you interrupted that pathway. Ibuprofen once, okay, maybe all right. Ibuprofen twice, well, maybe not. And so the more that you take it from an injury to get some relief from the pain, the greater chance that you're going to have an issue down the road. So I would just say respect it. I think ibuprofen, one of the times that it's really useful is if you're needing sleep and you're having issues sleeping due to an acute thing. Ibuprofen's a really bad idea for anybody long term. I use it so sparingly, and when I do, it will be for a very specific reason, specific time, one time, and then I'm trying to address the problem in a way that supports my body to be well, or try to address the cause of me taking it, like if it's pain in some other way. So ibuprofen, respect. The second I, immobilize. So we want to have function for healing as much as possible. This doesn't mean that, again, with the injury example, that you're going to be, rolling your ankle and then 3 days later you're going to be jogging on it. That's not really the kind of function we're talking about, but some normal movement of that ankle, for example, is going to be very beneficial for the healing of the connective tissues. There's going to be micro tears, maybe larger, of tendinous or muscle tissue or ligament, and so having some normal movement is really important. Immobilization, if you just think about the body in any other healthy state, it's not a static system. It's dynamic. It's meant to be moving. So, in the case of an ankle roll, having your foot up and still moving, some people have been told when they've been in the hospital or something like that for bad injuries to do the ABCs and that sort of thing with their foot. It's just keeping function. You don't want to immobilize. You're gonna have stagnation of blood and lymph in the tissue, and it's gonna impede the healing process. The third I, ice. How many people watching this have been told to use ice for an injury? This is a bad idea. So the same exact reason as the immobilization, really, except it's more powerful than that, is that you totally stagnate and stop blood flow to the area. The blood is bringing all of the lovely juice that's going to heal the injured area, and it's going to carry it away, and the lymph is going to carry the dead cells and everything away in the waste products. Ice is suppressive. That's why you put ice somewhere and the area gets white and it gets numb, because it's suppressing all of the blood flow and it stops the nerve conduction to the area, or slows it greatly. So we're better off using different hydrotherapy techniques that actually bring blood to the area. It will greatly decrease pain, and it will actually support the healing, the proper healing of an area. And it doesn't have to be an injury. I know a lot of people will use ice for chronic nagging pain issues that they've had for years, and ice makes it feel better. Well, of course it does. You're like numbing the thing out. But you're going to be a lot better off if you bring blood flow to the area. So that's one of the things I do in my chronic pain program that's aimed at musculoskeletal pain, is have people do contrast hydrotherapy. Okay, the last one, this is a big one. This is inject steroids. This is a very bad idea, and the conventional medical community recommends this all the time, because it's like pain, we don't know exactly why it's there, or it's osteoarthritis or something that's degenerative. Let's inject some steroids into it. Well, yeah, you feel really good because it suppressed any inflammation process that was going on. And guess what? It's really destructive and toxic to the cartilage in the joint. So if you have a joint pain issue and you're injecting steroids into it, it only takes a few times and you've greatly damaged that joint even worse, just to get relief from the pain, which I know can be huge. But there are other ways, and there's actually regenerative instead of degenerative. There's regenerative injection techniques that I do here in my office. So you can do things that stimulate the cartilage to regrow in a joint. You can do things that stimulate tendons and ligaments to get stronger and grow thicker, which actually is a very common cause of pain, is ligament and tendon degeneration. A good example would be after an injury, or someone who's doing a particular motion over and over and over. You'll be told most likely that it's tendonitis, and it's not tendonitis if it's been going on for a couple months or especially years. It's tendinosis. It's not an inflammatory issue anymore. It's a degenerative issue, and you need a regenerative technique. And there are some awesome injection techniques for that. So that's the 5 eyes. I hope that you got something out of this, that you're intrigued about the way that I think about pain as a naturopathic doctor. And if you have any questions, reach out to me at chironhealingarts.com.